Hello. As you know, I am Bella Borghi, the Executive Director and Vice Chairman of the Hispanic Health Coalition of Georgia. I am joined today by two of my prestigious colleagues, the first being Santiago Ramon. Good afternoon, Santiago. It's wonderful to see you.
Well, thank you so much, Bella. Good afternoon, everyone. It is a pleasure to be sitting here with both of you, honestly. It's just, wow, mind-blowing. So thank you so much for that. This is my second time here, so hope it goes well.
The next individual probably does not need an introduction, but I am humbled and honored to introduce my prestigious colleague, Dr. Jose Rodriguez. Dr. Jose Rodriguez, welcome, and thank you for all of your stakeholdership in our community. Could you please provide the audience with a little bit of history of yourself and credentials and what you've accomplished through your career?
Thank you. Thank you for inviting me. It's an honor and a pleasure to be here. And I guess you invited me because I can talk the talk because I've walked the walk, right? I'm from Puerto Rico, born and raised there, went to medical school there, undergraduate. I came to the land of opportunities for my residency program. In 1981, I spent 3 years in Augusta doing pediatric residency. My wife is a dietitian by training, registered dietitian. I have two daughters. They're both born in Augusta. Puerto Rico, there were nobody in Puerto Rico. Puerto Rico was born in Durham. Culturally, I'm sure they, two daughters, they're both pediatricians. One of them worked with me. The other one is at Emory. I've been very blessed that the community adopted me, accepted me. I've been practicing in Cobb County since 1984. I practice primary care pediatrics. I do have some special interests. But through my career, I discover through my patients unmet needs and opportunities. I remember I helped pass the law for newborn hearing screening in Georgia. Kenneth Stone Hospital was the first one in Georgia. No law, no budget. We had a family with 4 children. 3 of them were born deaf. We didn't know the first one. So the technology had developed, and we implemented that with the help of other pediatricians. Then I got Governor Barnes at that time to come and sign the law. I published some posters in Italy in a first world conference on newborn hearing screen. Soon after that, I had a mom who wanted her daughter vaccinated for HPV when she was 9. At that time, it was recommended at 11. But a lesson that I learned from my patient, that mom's sister died of HPV cancer. So it was a big opening that these things are preventable. You can do something from the time you're born with newborn hearing screening, cancer prevention. Soon after that, there were 2 deaths from a high school in Marietta from meningitis, freshmen in college. So I, along with a grassroots group of moms, teachers, nurses, and myself as a pediatrician, vaccinated thousands of kids and got the attention of the media and the legislators. So I helped pass a law for the meningitis in admission to colleges. There's a lot of other things done with COVID and the Hispanic community. For the last 20 years, I've been involved in a nonprofit that helps mental health meets the needs of mental health, primary prevention, secondary prevention, tertiary prevention, community engagement. So through my years, Atlanta Business Chronicle have recognized me. The Georgia chapter of the American Academy of Pediatrics gave me an outstanding award. I received many awards just because people have recognized that in my involvement and outcomes, improving immunization rates in the state, in the WellStar. I'll stop now because I can talk a little longer. But those are the little bigger of the biggest one.
Your accomplishments are voluminous. And I can say that from the perspective of having the honor to serve with you on other steering committees throughout the state. And as viewers are probably aware, Santiago and I work very closely in COVID-19, comorbidities, impact to the Hispanic Latino population. And we thought it was very important to address children in pediatrics from both a preventative and a real-time perspective. So vis-a-vis, that is why I asked our esteemed colleague, Dr. Rodriguez. Dr. Rodriguez and I also sit on the GC3 executive committee for the state, which is all things cancer, and also the HPV vaccination and work group steering committee for the state. So all things that come together with COVID and affect Hispanic Latinos through multiple generations. We've addressed some of that in our first series, and that is why we thought it was imperative to invite someone of Dr. Rodriguez's stature to join myself and Santiago. So welcome. I would like to kind of do an overview, if you can, from a clinical perspective, provide some of the statistical data on COVID-19 in the children's population and pediatrics from a perspective of cases, hospitalization, what immunizations were utilized, and also some of the other statistical data from a 10,000-foot view.
As in any condition, keeping track of numbers help put into context. I'm glad you used the word context earlier of how we are being affected. Could be car accidents, could be the consumption of soda. It doesn't matter. We keep numbers. We keep track of numbers. Data by itself sometimes have no meaning. But if you give meaning to the data and context, all of a sudden you have something called information. And if the information is useful, you have knowledge. And the more knowledgeable, powerful decisions you can make, the more knowledgeable. And one day we'll acquire the wisdom to have a better society. So thank you for all you do and inviting me. Specifically, as far as children is concerned, on an aggregate, if you look at the country from 2020, 21, and half of this year, we have 2.5 years of data to follow. And so far we've had 13.5 million children in a cumulative number tested positive for COVID. Just in this year alone, since June of 2022, we've had 5.7 million children. And in the last 4 weeks, 400,000 tested positive. So this is very much prevalent, high prevalent, and as we see later, it has a degree of severity associated, especially compared to the regular childhood illnesses that we're used to vaccinating our children for. We'll talk about that later. So the context is this is affecting children. If you think about regions, we divide the country into 4 regions. South, this region where we are, is very similar. The week by week, the amount of positive cases through the different regions, especially in the south, a little bit more noticeable, the peaks, how high they are. When we take into account that 22% of the population in the United States is children less than 18, it will come at no surprise that 20% of the cases tested positive are in children. So we cannot compare this condition to the adult world. We have to bring the context of what is it that we're talking about when we talk about numbers in children, how are they affected short and long term.
From the perspective of the cases and the amount of infection in children, from a pediatric perspective, what are some of the statistics as it comes to hospitalization, infection rates at that level?
If we can continue the conversation from the big picture to regional to our state, and to complement the data on the positive cases. If we look at the population in Georgia as of 2019, we had about 10.5 million, out of which about 3.7 is rural. Population less than 17, we had 2.5 million children. And if you look at the statistics in Georgia, almost a third million cases for a 16.4. Out of all cases in Georgia, 2 million out of 10 million and a half in population, 2 million total cases, about 300,000 in children. And that translates into what happened to these children, what happened just like in adults. If you look at the hospitalizations, we divide them into two types of hospitalizations. When we are suspecting or when we are confirmed a case is admitted due to COVID. I mentioned suspected because some of the symptoms, signs like fever, cough, respiratory difficulties could be attributed to many other germs, and sometimes the admission, when it happens, you don't have the immediate information when you report this to the state and the CDC. When we look at the confirmed cases, and we had in January, think about another aspect when we talk about hospitalization. There are peaks of positive cases. We had the highest peak ever since the pandemic started in January of 2022. And in the country, same thing as the South region, we talk about that. Same thing in Georgia.
Dr. Rodriguez, if I may, for some of our followers who may not understand, could you explain what a PIC is and why it's important as an indicator and kind of the layperson's definition?
Thank you. Yes. When you follow infections, given the nature of who gets infected, what time of the year, your health conditions, does it happen in the workplace, in the shopping centers, does it happen at church, at home, traveling. For a long time, we had bans on traveling because people were coming from other countries infected. There was a release on the ban because the infections are happening among each other. We don't have to worry about traveling. So what does that all mean? If you follow through week by week, just like many other conditions, allergies, asthma, influenza, we see that there are times of the year, either we are outdoors more often or the weather have changed, our body temperatures have changed, and the germ don't respond the same to the barometric pressure, the humidity in the environment, and you see a decrease in the cases positive. The circumstances changes, gets colder, barometric pressure changes, humidity changes, temperature, we're indoors more, and all of a sudden you start to report more cases. So those times we mentioned the word peak, so we associate them with elevations. Rapid elevations usually lags a week or two behind in the reporting, but that means that some circumstances were appropriate and there was a lot of infections happening.
Are you seeing in those children, or from your perspective as a pediatrician, are you seeing that in families that it is spreading through the children collectively? Are there some that it doesn't? What are you seeing as the big picture that kind of also goes with PICS?
When this all first started, we realized quickly that this is an adult problem. The adults that were not masking, not following the guidelines of keeping the distance, washing their hands, staying home, they were sick, getting tested, vaccinated. This is in the beginning of the pandemic. We quickly realized how quickly they became positive cases. Eventually, we'll talk about the consequences of this, the context of hospitalization and death. But soon, a few months into the pandemic, we started to realize, well, children do get sick too. Maybe not as sick, but they do get sick. And same thing applies, the contagious. Within a day or two of being exposed, you're already positive. It's very quickly. Within 14 days, you're still contagious in some instances. You're still testing positive. So how we understand this virus, what are we supposed to do with the children when they get sick, how to protect them, wearing masks, keeping them at home. We'll talk about the consequences of all this with school and mental health and so forth.
Dr. Rodriguez, we've spoken from a 10,000-foot view of cases, numbers, statistics, also hospitalizations. What have we seen in trends in death and morbidity in COVID-19 overall, but then more specifically to children and pediatric elements?
Yes, thank you. To continue the idea of giving context and meaning to all this data, the consequence of this pandemic is the death that we've experienced. As of June 2nd of 2022, we've had 1,005,000 deaths in the country in the last 2.5 years of this pandemic. However, we quickly realized it doesn't affect everybody the same. We realized early on that there was a population that was most at risk, those 85 and older, and almost a third of those deaths are in that population. They don't represent a third of the population, yet they're the highest, most affected. As far as children, locally the death is not as, the numbers are not as big. However, keep in mind that 22% of the population is children less than 18. So in children, as of when we're taping, we've had 1,086 deaths in children less than 18. And for those children less than a year, we've had 300 deaths. It might not sound a lot, but it's only 20% of the population. And some of these children, it is true, they had other serious health conditions, but many of them were completely healthy children. So this is a serious problem, and it's preventable.